Hello everybody, my name is Jeff Moulter and I'm here today to talk to you about request cases. Now, as you can see from my title slide, I feel that a request case is an honorable burden. It's a double-edged sword, and what do I mean by that? Well, for those of you that work in anesthesia, you know that when someone asks you to do their anesthesia or do the anesthesia for their son that's having a tonsillectomy or the anesthesia for their spouse, that it's quite honorable. It means that they see something in you that they think is that you have a lot of skill, or that you wake up your patients very quickly, or the way that you handle your pre-op interview. So it's quite an honor to be asked to provide anesthesia on a request case scenario. But at the same time, it's also a burden. And at least I think personally that when someone asks you to do their anesthesia or their family member's anesthesia, it does feel somewhat of a burden because any little thing that could go wrong, and anything that does go wrong ends up harming your reputation. And I have a few examples of what I'm talking about, but anyhow, I'm going to bring you back to the year of 1893, and I'm going to talk to you a little bit of a time frame here. 1842 is when Ohio Wesleyan University was founded. Big deal, like you care. That's my alma mater. I went to nursing school there down the road here in Delaware, Ohio on Route 23, but fantastic school. In 1845 and 1846, we had the first public demonstrations of nitrous oxide and ether at the Ether Dome at the Mass General Hospital in Boston. So anesthesia was just starting to kind of come around. And in 1886, we had the birth of what we know as the modern automobile. And of course, in 1903, the Wright brothers took their famous flights in Kitty Hawk, North Carolina. 1893, the reason 1893 is significant is because in 1893, that's one of the first documented cases we have of an anesthesia request case. And what that request case was a gentleman by the name of Ferdinand Hasbrook, who was a very skilled dentist who was very skilled at the nitrous oxide technique. Now, Hasbrook was requested by none other than the president of the year, and that was Grover Cleveland. And you can see from this picture, Grover Cleveland was a rather svelte and stout man, weighing somewhere around 300 pounds, which was pretty large for those days. But what happened was, in the beginning of 1893, the president's personal physician, O'Reilly, recognized that the president had a growth on his hard palate, and he recommended that he have this growth removed because he thought it was probably cancerous. And unfortunately, in 1893, the United States economy was doing very poorly. Many of the railroads were going bankrupt, and there was a general panic in the United States as far as the economy. The president and his staffers felt that it was probably in the best interest of the public that they not know about him having this surgical procedure. So they planned that Grover Cleveland would have a secret surgical procedure performed on July 1st of that year, and they asked Hasbrook to provide the anesthetic. Now, Hasbrook was very skilled, and if you think back in time here in 1893, there were many things that were not available to Hasbrook at the time. There were no intravenous fluids, there were no monitors, there was no oral airways, no laryngoscopes, no blood pressure cuffs, and no endotracheal tubes. So this must have been a formidable task for Hasbrook to administer the nitrous oxide to the president, especially being that it being a secret procedure. What ends up happening is that they meet in New York City on July 1st, and they board the Oneida, which is a yacht. One of the best buddies of the president owns this yacht, and the yacht sets sail from New York City to Buzzards Bay, Massachusetts, and they actually perform the surgical operation on the president as it sails from New York to Buzzards Bay, Massachusetts. Now, what they ended up doing is Hasbrook ends up administering nitrous oxide mixed with room air via a face mask, and he applies this face mask intermittently to the president. And when the president is adequately obtunded, the surgeon by the name of Bryant injects cocaine around the hard palate. After he numbs up the president significantly, Hasbrook proceeds to remove a few of the president's teeth, and the surgeon and his assistants end up moving about a third of the hard palate. And during this time, they control the bleeding with hot compresses. They unfortunately for Hasbrook, he runs out of nitrous oxide after about 40 minutes, and the surgical procedure itself was documented as taking about 2 hours. So the president's personal physician ends up giving the president ether for the last hour and 20 minutes to get him through the procedure. The entire procedure is done through the mouth. There's no scars or anything left like that. And when the procedure is done, they give the president 10 milligrams of IM morphine and send him to bed, and the president sleeps through the night. And on the second postoperative day, he is up and out of bed, and he's doing quite well. Now, Hasbrook asked on one condition that he would participate in this procedure if he was allowed to leave the ship after the procedure. Well, the president's people felt that they couldn't honor this request because they were in fear that Hasbrook would blab and talk to people, and they didn't want this getting out to the general public that the president had this procedure done. So they detain Hasbrook for one more day, eventually letting him off the ship. And Hasbrook gets back to his hometown in Connecticut, and his physician partner, Leander Jones, is really pissed off at him. Leander Jones had scheduled a few appointments with Hasbrook the day before and had to cancel these appointments because Hasbrook didn't show. So Jones asks Hasbrook for an explanation, and Hasbrook proceeds to tell Jones exactly what he was doing and where he was, working on the president. And Jones, being the mouth that he is, ends up spilling the beans and telling his buddy, who is a reporter for the Philadelphia Press. His name is E.J. Edwards. Now, E.J. Edwards ends up writing an article in the Philadelphia Press about a month after this surgical procedure, giving a detailed account of what happened. Well, of course, this gets back to President Cleveland and his staffers, and they're really annoyed, and they know that Hasbrook was the one that spilled the beans. So what they end up doing is basically telling the public that Hasbrook was a quack of a dentist. He was asked to remove a few of the president's teeth, and he botched the job. And because he botched the job, they needed some other doctors and surgeons there to help repair the damage that was done by Hasbrook. The president's staffers basically discredited Hasbrook and E.J. Edwards, the reporter, and called them liars and basically ruined their careers. Now, it's hard to believe, but back in 1893, the public actually believed the president's word over any of the reporters or of that of Hasbrook. So Hasbrook's career was ruined. He was never the same. And what can we learn from that? We could learn that even when you do a request case and you do a great job, you could still have a poor outcome. I mean, I know that HIPAA wasn't around in 1893, but you could see that just a simple, telling your friend what happened, how that could cause something to go really wrong. Now, I'd like to talk about why I thought this would be a great topic. About 6 weeks ago, I was asked by Lisa Willie if I would be interested in giving a presentation at the meeting, and I told her I was really interested in giving a presentation, but I didn't quite have a topic yet. And sure enough, within about 2 minutes, my friend Kim here, who I work with at Finley Surgery Center, comes up to me and says, "Hey Jeff, my sister is having surgery next week. Would you mind doing her anesthesia?" Well, the little light bulb went off in my little brain, and I thought, this would be a great topic to discuss at the fall meeting, because how often do we talk about request cases and VIP anesthesia? Well, Kim's sister was having a vocal cord biopsy done, And the thing about Kim's sister is she had some medical problems. She smoked 2 packs a day. Her BMI was in the mid 30s. She had an anxiety disorder, and she also was claustrophobic. So I thought it was going to be a very difficult case to do, and I was very nervous about it. But Kim's sister ended up doing quite well. The procedure went well. In the recovery room, she got a little bit anxious in the afterwards because when she went to take a deep breath, she felt like it was hard to get her breath. So I ended up giving her a little bit of Versed in the recovery room, and we talked her through it, and she ended up doing quite well. But I'd like to thank Kim and her sister for bringing it to my attention that this would be a great topic to discuss. Now, the fact that I was on this end of a request case doesn't mean that I'm immune from actually requesting someone myself. I actually underwent a knee arthroscopy about 3 months ago at our surgical facility, and I requested Scott Urigal here, who is one of my business partners. Now, Scott is an excellent anesthetist. He's really good at regional anesthesia. As a matter of fact, he gave a talk yesterday about the rectus sheath blocks performed with ultrasound. And I know that when I asked Scott to do my anesthesia, I'm sure he was a little bit hesitant. And I think that he felt the same as I do, is that it's an honorable burden. That on one hand, it's an honor that someone would ask you to do their anesthetic, but on the other hand, or the other edge of the sword, it's quite a burden because you know if something goes wrong that basically it'll be rough. Now, in all the research that I did on this topic, I came across something called VIP syndrome. And I thought that VIP syndrome was closely correlated with request cases. Now, what is VIP syndrome? VIP syndrome was something that was actually recognized in the 1960s, and what they found was that when physicians and nurses had VIP patients, they quite frequently made bad judgments, they performed unnecessary tests, they did a lot of second guessing, and in the end, the VIP patient received substandard care. And that's the last thing that you would think of, that a VIP patient would receive substandard care, but that's exactly what they found. And a couple examples of this would be Lou Gehrig, who was a phenomenal baseball player. He played professional baseball for the New York Yankees in the 1920s and the 1930s. And Lou Gehrig had a great reputation as being a slugger and a hard worker. And he held the Major League Baseball record for the most consecutive games played without ever missing a game. It was over 2,000 games that he played in. And he derived the nickname of the Iron Horse. Well, Lou Gehrig in the late 1930s started to struggle with his ball playing. He wasn't hitting the balls far. His batting average was going down. He wasn't fielding the ball as well, and he went to his own personal physician, told him what was going on, and his personal physician, who was a stud physician at the time, felt that Gehrig was suffering from gallbladder disease. So he recommended that Gehrig change up his diet. So he recommends that Gehrig change up his diet. Excuse me for a second here. Sorry about that. So he recommends that Gehrig change up his diet. So Gehrig follows the physician's orders, and sure enough, he ends up getting weaker and not playing as well. And so Gehrig eventually gets tired of this advice, and he seeks out his own advice, and he goes to the Mayo Clinic up in Minnesota, and they run a battery of tests on him, and they discover, sure enough, that he has amyotrophic lateral sclerosis. Now, this is the disease that eventually gets the name of Lou Gehrig's disease, but shortly after being diagnosed, Gehrig passes away over a two-year period, and he basically suffered from VIP syndrome. And you could argue that the physician at the time didn't really have the greatest diagnostic tools for discovering what Lou Gehrig had, but at the same time, the fact that Lou Gehrig was known as the Iron Horse, made the physician very hesitant to do further testing on Gehrig, even though he was declining. The second example I have is that of Ted Kennedy. Now, Ted Kennedy was the fourth longest serving senator in U.S. history. And Ted Kennedy discovered that he had, after having a seizure, it was discovered that he had a glioblastoma, a very rapidly growing brain tumor. Ted Kennedy was able to assemble his own tumor board, which is quite remarkable, but due to the fact of his fame, his power, and his wealth, he was able to come up with his own tumor board. Interestingly, the tumor board ended up being divided up into two teams. He had his Harvard team, or his Harvard boys, then he had his Duke University team, which was his Duke boys, and not John and Bo and Luke Duke from the Dukes of Hazzard, but the Duke University surgeons. Well, anyhow, these two different teams have different opinions, and the Harvard team thinks that it's in his best interest that he have non-invasive, that he not have surgery, that he have chemo and radiation, and that would extend his life the longest. And his Duke University guys recommend that he have surgery, and they feel that this will prolong his life. So he ends up deciding to have the surgical option, and within 15 months of being diagnosed and having surgery, he ends up passing away. Now, did he make the correct choice? One only knows, but you couldn't argue the fact that with his wealth, his power, and his fame, that VIP syndrome somewhat had a play in his time here. Another example of VIP syndrome is former President George Bush. Now, this was just recently in the news at the beginning of August, but the former President Bush, who we all know to be an athlete, he's a runner, he's a cyclist, he had a routine physical done, and during the routine physical, they performed a stress test on him. Well, he was asymptomatic, but he had some type of ST elevations or depressions, and it was felt that he should have a CAT scan of his heart and his coronary arteries. Well, this CAT scan reveals that he's got a blockage in one of his coronary arteries. So what do? They sent him to the cath lab the very next day, and they put a stent in one of his coronary arteries. Well, this drew a lot of attention in the press, and the head of cardiology at the Cleveland Clinic and the former head of cardiology at the Cleveland Clinic, Eric Topol, came out and said that they felt that this was ridiculous, that there has never been a study that has shown that putting a stent in someone without symptoms improves their longevity, their lifestyle, or prevents an MI. So it kind of blasted the institution down there in Texas that did this procedure on him and said it was unnecessary. So once again, is this another victim of VIP syndrome? Now, one of the most famous victims of VIP syndrome, and it's somewhat anesthesia related, is Michael Jackson, the old king of pop. And we can thank Michael Jackson because to this day, when you tell someone the medication you're going to give them for their sedation, they always say, is that the drug that killed Michael Jackson? Unfortunately, Michael Jackson was known as the king of pop, and now he's known as the king of propofol. Now, Michael Jackson, for those of you that don't remember, he hired this gentleman by the name of Conrad Murray. I believe he paid him about $150,000 a month to basically provide him with propofol and some oral benzodiazepines to help him sleep and to give him sedation. We all know how this ended up. Michael Jackson was unattended, and he must have had a period of apnea, and unfortunately he died and he passed away, becoming a victim of VIP syndrome, probably one of the most famous. Now, I want to bring you back in time to the year 1997 when I was a student anesthetist at Mount Sinai Medical Center in Cleveland, Ohio, this beautiful purple building. And at that time, I worked with a surgeon by the name of Dr. Lu Jean Feng. And like it says, she was internationally renowned microvascular plastic and reconstructive surgeon. Lou Jean was pretty famous. She was on 2020 several times, speaking out against the manufacturers of breast implants that were filled with silicone. She believed that the silicone implants were actually causing harm to females, and she recommended that they get them removed. Well, Lou Jean, being that she was famous, we ended up seeing a lot of famous and VIP patients. And with that being said, many of the Cleveland Indians and their wives were coming in at that time to have breast augmentations and tummy tucks and things of that nature. The funny thing is at this time the Cleveland Indians were an awesome ball club. They sold out all their home games. They were in the playoffs. They were in the World Series. So everybody in town knew who these guys were. And I learned an important lesson back then. There was one morning where I was checking the assignment and I saw I was going to be in Dr. Fang's room. And it was quite obvious that the name of the patient, that this patient was the wife of a Cleveland Indians player. And I went up to the scheduler and I said, you do realize that I'm a student anesthetist, correct? I felt like this might have been a mistake. So the scheduler says, you know what? We treat everybody alike, and that's your room, so get in there and do your assignment. So I was quite shocked for a few minutes, but I thought to myself, and I said, that makes sense. And the funny thing is, I didn't really think much about it until years later, and I thought, what a valuable lesson. And what I learned was that as anesthetists, we do things for a reason. So when we set things up in a room, when we draw things up and we have a routine, there's a reason why we do things the way we do, and it's because they are time-proven methods, and these are methods that have proved the most effective for us over time. So if you're a student anesthetist and you work with a CRNA and they do something a certain way, they may not even be able to explain it to you why they do it, but time has proven to them that that's the best way to do things. Now, do not ever deviate from your usual protocols. What I mean by this is if you do anesthesia on a patient and if they're over age 55, you ask that they have an EKG. Well, if you have a VIP come in and they're 58 years old, just because they're a VIP doesn't mean you should skip the EKG. I mean, if you deviate from your standard protocol, you're actually setting up this patient to get substandard care, and you're setting yourself up to probably make a mistake. Also, treat your request cases and your VIPs like everybody else and the procedure like every other procedure. I know this is easier said than done. As a matter of fact, I just had a request case that I did today, and it was on a former surgeon that I used to work with, and I was asked to provide his anesthesia, and all he was having was a simple knee scope. And I treated him like I did any other patient. The only thing I did differently was that maybe I spent a few more minutes with him in the pre-op area talking to him, more of a BSing kind of thing. And then in the phase 2 area, when he was wide awake, I went over there and chatted with him and his lady friend for a little while. And that's really the only thing I did different. But I treated that case and I treated him like I would anybody else. So I'd like to ask you, what have you learned in your time, in your years, as far as doing request cases and VIPs? Now, in summary, I'd like to say that if you treated this hernia patient in Haiti, you treated him and his anesthesia like you did this gentleman who had a glioblastoma surgery, like you did this gentleman that was having a hemorrhoidectomy, if you treated all three of these people equally and in the same manner, I know that's very ideal, but basically you're reducing the chances of having mistakes and you're eliminating the chance of making errors. So with that being said, I'd like to end with a saying from Aristotle: we are what we repeatedly do. Excellence, then, is not an act, but a habit. And I'd like to add to that in the beginning. As CRNAs, we are what we repeatedly do. Excellence, then, is not an act, but a habit. With that being said, I'd like to say thank you for being a CRNA. Thank you for listening to my presentation. If you have any questions, please email me at jeffmolter@me.com. JEFFMOLTER @me.com. Thank you very much. And on behalf of the Ohio State Association of Nurse Anesthetists, have a good day.